like to welcome our second guest on the show today. We have Dr. Megan, Dr. Monique, and Dr. Brent from Family First. Thank you for being on my show today.
Thank you for having us.
Thank you for having us.
Let's start with you, Dr. Megan. How long have you been at Family First, and what's your title?
My name is Dr. Megan Powell, and I opened Family First in March of 1999. So
wow.
We've been here serving Brunswick County for over 16 years.
Awesome. What about you, Dr. Monique?
I have an interesting story. I was actually a patient at Family First Health Center when I was in high school, about 10 years ago. And I got inspired to be a chiropractor while at the office. And so through their guidance, I went to chiropractic school after graduating from UNCW. And the opportunity was just at the right place at the right time for me to come back and be a part of Brunswick County and help the community.
Wow.
At my hometown.
And what about you?
And I've been in practice for 18 years. I've been down helping Dr. Megan and Family First for the last 2 years.
Okay. And do you have other staff members as well as y'all?
We do. We have 2 full-time massage therapists, Josh Robinson and Casey Robinson. They're actually a husband and wife team, which is really neat.
Yes.
But we offer them male and female therapists, which a lot of people have a preference. We also have 3 full-time kind of assistants in the office. Heather Holden has been with us for over 13 years. Maria has been with us over 10 years. And Mary just got married. Mary is our newest member. Mary just got married. She's the newest member to our team, and she's been with us a couple months.
Wow, so you have some long-time employees.
Yes,
That's
yes.
awesome.
Yeah.
So for our viewers that don't know what Family First is, tell us a little bit about the background of Family First. And I'll ask you, Dr. Monique.
Well, the background of Family First, we are a chiropractic office, first and foremost. Yes, we do have massage therapy. We also help people with their nutrition. Most of all, we're wellness experts. We want people to be well from the inside out, through the chiropractic philosophy. True healing and health really comes from above down, inside out, meaning your brain down through your spinal cord, out those nerves to all the cells, organs, tissues of the body. So at our office, we view health a lot differently than the medical profession, in the sense that we look at what's causing the issue from the inside out and work on addressing that through nutrition, through chiropractic, through soft tissue, with massage, and any other forms that we have to help address what's going on with the body without the use of drugs or surgery.
Wow. So if I was a patient of y'all's and I walked in the door, what would be the steps that I would take as your patient? And I'll open that up to any of you.
So normally you would come in and do the standard, and we would get the paperwork, and we do a very thorough history to find out where your past may have actually affected your today. And then we also go through a very specific exam looking for subluxations, because that's what we primarily focus on in the office, because that way we can take the stress off your nervous system and allow you to really express true health. And then we'll most people will need a set of x-rays, so we take a full spine set of x-rays to see exactly what's happening with your structure and how it's actually affecting your function.
And you could do that all in the office?
And we do that all in the office that day. And then we normally invite people back to go over their results and explain that to them in detail. Any sort of, we explain to them what would be needed with their care, what they can actually do for themselves, and just set them up for a brighter future, and then figure out where they go from there.
And with, a chiropractor or some of the other services you provide, I know it depends on the patient, but what's the average of how many times they're coming per week? And like I said, I know it depends on the patient, but what's normally the average?
We have patients that start, if they have more acute issues going on, that might come daily for a week or two, based on how much pain they're in, how much of a crisis their body might be going through at that moment. We have patients that start 3 times a week. It just depends on what's going on with them. I've been there again since '99, so over 16 years. And I have patients that have been coming for wellness adjustments once a week or once every 2 weeks the whole 16 years. And so for some people that's different. They're like, wow, that's a lot. But they don't, once a patient gets under care and they see how much healthier and how much better their body functions, to them it makes much more sense to continue to maintain that than it does to go back to where they were.
Exactly.
So the patient chooses how often they want to come. We don't force anyone to come. We're not holding anybody captive. That is the patient's choice. We're obviously going to give them our best recommendations. I have 3 children that have been getting adjusted since birth, and I know Dr. Mo is going to talk a little bit about our pediatric and pregnancy work, but they've been getting adjusted since birth. The birth process itself can be somewhat traumatic, just the pulling and tugging and twisting. I check my kids, or I actually have one of them do it now. It's better to have somebody besides mom. Check the kids once a week just to make sure that their spine and nervous system is healthy. They don't always need to get adjusted. It just depends on what's going on. With children, the adjustments are very low force. I mean, it's nothing. If anybody's been adjusted and they wonder, how do you do that with a baby?
Right.
It's different. It's like massage weight pressure. But we definitely love to see people fully expressing health from birth till, however old they live.
I know.
I think our oldest patient right now is 102, I think.
Wow.
We have several in their 90s that are still fully driving, very active. And we love to see that. That is what life is. It's fully living. We want to see that and help people express their God-given potential. So that's obviously kind of our mission.
Yes. We'll talk a little bit more about kind of what sets you aside from other health facilities in Brunswick County. But tell me a little bit about the services that you can provide here in Brunswick County. I'll open that up to whoever.
So obviously, adjusting.
Right.
And so we also give very specific exercises for those patients on what they can do for their future, because we're not just interested in helping them get better for now. We want to educate them on how they can stay better and continually improve. We also offer many classes. We do smoothie classes. We do stretch classes. We've done a purification workshop to just help people work better, lose some weight in the process, which is awesome. We do a ladies' night, which is just getting the community together and just letting them experience more health items and just have a night out. We do all sorts of health classes throughout the year, and we have various things going on in the month. We also like to do a meal planning class, because obviously day to day we're all busy, and so it's hard to we think it's hard to eat healthy because we just don't know what to do.
Yes.
And so we just want to detail it out and make it super, super simple so that it's easy to stay on the right path. Nobody's perfect, but we want to just strive to be better.
So as somebody, I love that class, so I want to touch on that just a little bit. I was unable to go to the one that you had last time, but I'm looking forward to going to the next one. But as an event planner and as somebody that works at the chamber that has a super busy schedule, how is that going to help me in my lifestyle with that class that you were just talking about?
Well, it makes things easy because, you can actually just put together a plan, prepare, which is usually where most people fall down, is they just don't prepare enough for their meals, and so they're grabbing something quick and easy. And so it's allowing you to just know what you're going to prepare for the week, planning it out in a menu, and then actually just making an easy shopping list, getting it done over the weekend so you're prepared for the week. That way your busy lifestyle doesn't get in your way.
That's wonderful. So excited on that one.
Dr. Brent says it best. He always tells our patients, life gets in the way.
Yes,
so you got to
prepare.
It does,
but I'm always constantly picking up bad food because I don't have time to cook or whatever. So I
that's
think,
what we're trying to do.
Yes, I think our viewers would really like that class, and we'll talk about it a little later of maybe when you'll have your next class. But at Family First, what do you think, what are some things that sets you aside from other health facilities in Brunswick County?
One thing, I'll start a little bit about this. I mean, since I opened Family First, the number one priority is to make sure that every patient is treated like a champion. We want every patient to feel special because they are. And we realize they have a choice on where they receive their care, and so we want them to realize that we value the fact that they've chosen us, and we don't take that for granted. We genuinely love and care for every patient that walks through the doors. They become part of our family at Family First. And we feel that way. I mean, we often attend birthday parties and graduations and weddings, and this is part. I mean, we're part of their family. We're part of their life. Your health is a very personal thing, and so we definitely feel like you have to connect. You have to be willing to listen. We listen to what our patients need. We're there for them. And, and we want to be along with them. Like Dr. Brent said, we want to give them things they can also do outside of being with us to stay healthy and to keep healthy. And that's important. So giving 100%, customer service, making sure that they feel valued and loved, that's definitely a priority and a commitment with our whole team.
Absolutely. Anything else you want to add to that?
That's first and foremost. Anybody that walks through the door, it is them and them first. No matter what's going on, they're choosing to come and get their health taken care of at our office, and it is our job to, show them love, show them, even if they didn't need an adjustment that day, maybe they needed, a smile or a hug or just someone to listen. Because life is so hard on our and in society these days, and so for us to be a part of them and in their life in that manner is our number one goal. Our mission at Family First is to educate and adjust as many families as possible towards that optimum health through chiropractic care, and that's just our vessel that we use to touch people's lives in that way.
I think another thing that really sets y'all aside is you're so involved in the community. As a chamber member, we're always looking for your events in Brunswick County, and we try to be there as much as we can. But touch just for a few seconds on some of the events that you do. I know you've talked about them, but some of the events that are coming up that you do.
Well, one I know that we have coming up in November is another meal planning class. The holidays always get all of us.
Yes.
There's a lot more temptations all around, and also just the hustle and bustle of all the parties and get-togethers. And so planning is essential. Not only, like Dr. Brent mentioned, making sure we are prepared and thinking ahead of time, but also how to be as cost-effective as possible, turning meals into other meals. And so that class we will have in November. And so definitely they can check the website, and we'll get that information later. We also do our ladies event it's usually in April. Every April we have a ladies night. Again, Dr. Brent touched on that. Just an opportunity for ladies to have a night out. We pamper everyone. We have lots of fun, food and vendors, and just, again, a time to relax and to find out different options of different healthy things they can do for themselves. So that's another big event. Anything else you want to mention?
Stretch classes, we do those pretty much every month, so we'll be having those. Just keep an eye out.
I need to come to one of those.
Yeah. Everyone needs to show more.
Yes, absolutely. Well, I think we have gotten some great information from y'all, so I really appreciate you being on the show. If we've got somebody that's interested in coming to see y'all, can you share, Dr. Brent, your contact information?
Absolutely. First, you can visit us at our website. That's www.family1chiropractic.net. You can also find us on Facebook. Just do a search for Family First Health Center. Our phone number is 910-755-5483. And we're located at 4911 Bridgers Road. We're just right across from Autumn Care.
Okay. Well, thank you again for being on the show. Family First. Thank you. We'll be right back.